if you have children, I would say the pediatrician should be doing a routine screen on the child when they go for their well visits, but I would say no later than by age 5. Yeah, and if they're 5 or older, then for sure they should see an eye doctor, even if they have no complaints. Because sometimes you don't know. I've had a lot of kids come in that are with their parents. They're 15, let's say, checking the vision, 20/20 in this eye. Go to check this eye. They can hardly see the big E, and the parents never knew. And the kids sometimes don't know because you don't go around doing this.
They don't know what clear is, so they don't know how clear things are supposed to be, and it's not until they're caught through a school screening or pediatrician that they get sent over, and that's where I notice, wow, you have a pretty high prescription there, and even parents are surprised.
So if you see a child before they get to be 7, 8 years old, if they do have a lazy eye, we can patch the good eye and make the lazy eye work and hopefully get the vision to be comparable to the good eye.
Kids have really strong eye muscles and they can really accommodate, but that's only gonna work for so long before they start complaining about headaches. They're gonna start falling behind in school. So definitely monitor for those things, squinting, getting closer to the TV. Sometimes there's subtle signs. Sometimes it's not even that obvious either. So
the pediatrician should pick those things up, but not always. A lot of times the school screening will pick them up.
That's why school screenings are important, at the nurse's office, and then that doesn't stop there, that's just a screening to see how well you see. You still have to make sure that the health of the eye is okay, because it happens. Kids don't know how clear things are, even adults.